This whole week, we've been shining a spotlight on infertility, something that isn't always talked about openly. It is, after all, National Infertility Awareness Week, and it's important that folks know they are not alone in seeking help. But what can you expect when you meet with a doctor? Here to let us know, we have fertility specialist, Dr. Carlos Sueldo. He's the department chair of how do you say it, doctor?
Obstetrics.
Obstetrics.
And gynecology.
And gynecology. Thank you for that.
Yeah.
At UCSF Fresno, he's also the founder of Women's Specialty and Fertility Center, a wonderful group here in town. So welcome, doctor, to the program. And I know you mentioned we talked to your colleague the past 2 days.
Right.
But today we're talking to you.
Okay.
And so tell me, first of all, what problems are you seeing? Has infertility always been around? It's just more spotlighted now?
Always been around.
Yeah.
Obviously, there's a lot more attention paid to that right now. But to break down the major causes of infertility, we need to say that 50% of the cases involves a male factor. So in 35%, just that as a factor would be an absolute male factor, infertility. And in 15%, it'd be shared with a female factor as well.
Yeah.
On the female side, chronic anovulation, lack of ovulation is a very, very common factor that we see, as well as tubal disease and uterine factor infertility, which are, especially uterine factor, less common. And then there's 15% of all couples that cannot conceive, whereby all the testing shows up to everything is normal, yet pregnancy is not taking place. We label those patients as having unexplained infertility. And 1 out of 6, 1 out of 7 couples that are infertile suffer of unexplained infertility.
Yeah, that must be hard.
It is, yeah.
So tell me, when should we consider starting a journey with an infertility specialist? Is it after a year, 6 months?
Well, it's a good point. For the majority of the couples, especially those that are under age 35, will be a year. So especially unless, if there is no obvious reason to explain the infertility. But if someone is in the upper 30s, then a year would be too much. It'd be probably wiser to start the workup, the testing, within 6 months of trying.
Okay.
So the couple tries for 6 months, there's no pregnancy, then you should consult your physician.
Okay, so I make an appointment with you.
Yes.
And what is that like? What's the first appointment like with the couple?
The first appointment with the couple is to go over their history. That will include a physical exam, including in the female a pelvic ultrasound. And then we begin the major testing, so to speak. The causes that will tell us more about why pregnancy is not taking place. So we will order a semen analysis on the husband. We will order an x-ray of the uterus and fallopian tubes on the female. And we will order also some hormone testing that will be very, very valuable to tell us how her ovaries are functioning.
Yes.
And what her ovarian reserve is like.
I think a lot of folks just jump to IVF. They're familiar with that word, but perhaps there's some other options before IVF.
Absolutely, especially for young couples or younger couples. I think the use of other means that are less effective, but that would be less costly and would be actually a much easier way to obtain a pregnancy rather than going straight to in vitro fertilization. In vitro fertilization has a specific indications, but in many other couples, you should try other options first before you jump into doing IVF.
Because you mentioned it's a little costly, and what else does it entail? It's very invasive.
Well, to a degree, is really the most invasive portion, physically speaking, is the retrieval of the oocyte, the eggs, out of the ovaries, which is done under intravenous sedation, transvaginally. So there's no surgery per se, except obtaining those eggs that are present in the ovary. After that is mostly a heavy work in the laboratory, trying to get eggs and a sperm together, culture embryos, and then the female comes back for the embryo transfer, or what's being cultured for the past 3 or 5 days
Right.
in the IVF lab.
So, doctor, what's your lasting message for couples? You want them to have hope? You want them to know resources are available in their own backyard?
Absolutely. Our fertility center in Clovis is the only complete program here in the Valley from A to Z, and we have a pretty sophisticated laboratory and laboratory director and embryologist. We are able to offer all the various techniques that are offered anywhere else. So yes, they should have a consultation to clarify certain issues so that we can actually pinpoint to them the sequence of events that are going to be taking place and the options they have. And some patients prefer to have a low effectiveness, low cost treatment initially, while others, just to say some physicians, for example,
Yeah.
I just don't have the time to
Yeah.
do this every month,
Right.
but I want to do it in 1 month,
Yeah.
the month of June. And for those patients, obviously, some more procedures that are actually more effective would be the way to go.
Lots of options out there, folks. Women's Specialty and Fertility Center. Give them a call today. Thanks so much, Doctor.
Thank you very much. Thank you for your time.
you.
Thank you.